Welcome to ADAPT NCLEX, and thank you for deciding to watch this video. This video is designed as a motivation video. That's all. There's nothing to it, just to motivate people out there who are struggling, trying to pass these exams, those who have failed multiple times. There is hope. Just find a place that can give you enough information with some strategy and build some confidence in yourself when you go. Confidence in yourself that you can handle this. Take away the anxiety and focus on the exams. With your content, there's nothing that they can ask you. But when you start wavering, start getting scared, then you get into trouble. So this student of mine, with their permission, I'm sharing this audio with you. You guys know I like audio. And so this is what she has to say. And this is a message she sent after she passed, that she passed with the minimum number because she did not have to memorize anything. She understands the questions, she know the content, and she just using it to answer the question with some confidence. You find your way through this. You won't know everything in the exams, okay? But you have to know how to navigate yourself through. And what is the secret? The buzzwords. That's what she said. And that's what I did with buzzwords. And so, yeah, from my home, man.
Thank you so much for your help in preparing for this exam, because the way you taught us and the way you broke things down to us in simple forms that we need not cram made this exam way easier for me to pull through. I'd say I passed with 85 questions, and what helped me the most was the case studies, and it's all by your help and God's, because once I cited the case studies and I read through the questions, all I could see myself asking was, okay, what is the buzzword, or what are buzzwords here? And I was immediately and instantly able to pinpoint the key answers in the questions. And I'd also like to say that your acronyms, the way you give acronyms to medications also helped a lot, because there are some medications that they give, like the psychiatric medications and all of that kind of medications, that all I just needed to do was just write down the acronyms, and from there I could pick out the side effects or the adverse effects. Like, it was way easy for me to do that. The ADAPT NCLEX is also, the Next Gen NCLEX is also way easier, because you don't have to select all choices in the select order apply. You just have to pick things that answers that you feel that you are very sure of. And I feel like that also helped a lot. So my advice to people that are yet to write theirs is to take their time in answering questions. In the case study, you have high chances of scoring so many points, and it is really easy, I'd say, if you take your time to read the questions and the author's diagnosis, as well as just read the questions well and be able to recognize the buzzwords. You'd be sure to get more points there. And also, if by chance you missed out on a diagnosis or an answer, don't get discouraged or lose focus. Just keep going with what you now know, the information you now know, to answer other questions. Your case study will surely give you as many points as you want. And also, the select order applies. Only pick answer choices that you're sure of. Don't pick things that you don't know. It's better to get 2 points than to get none. Also, I'd like to say that take your time to answer questions. Don't be in a rush. As much as the case studies might be a lot to read, I don't think it is a lot too, because the question will always tell you the passage or the paragraph to read for the next question. So you don't have to keep going over each passage again to read, unless you really need to. So basically, the time will be enough. You should just be conscious of you should be more conscious of how well you're answering the questions than how far you've answered. And lastly, I'd admonish you to pray, pray and do your best and leave the rest to God. Also, go on ADAPT NCLEX YouTube channel and watch his videos. There's this 7-day priority, I think 7-day priority NCLEX questions or something that he posted there. Like, take your time to watch the video system by system, and this will really, really help you, because it did for me. But I did take my time to go on his YouTube page, and I went through these videos, and it so helped me in building or consolidating my content my content knowledge. So I'd say I'd admonish you to go, aside attending his classes, go on his YouTube pages and watch his videos. It is really, really, really so helpful. Thank you so much, sir. Once again, I really appreciate your kind help, and I pray that may God in his infinite mercy continue to protect you and yours. Amen.
So she mentioned something about buzzwords. Do you know what it is? Let me show you. And this is the key for every NCLEX question, strategy, anything they give you. If I give you a 55-year-old man, okay, or client, okay, present with, what is their complaint? Chest pain, okay, that is relieved by leaning forward, and you get an EKG, show ST diffused, ST elevation. You don't need any more information. So if they put it in the case form, they give you 15 paragraphs. All you need to care about is, I have a 55-year-old client. He presents with the chest pain that is relieved by leaning forward. And when you get an EKG, there is a diffuse ST elevation. That's all. They will disturb you. They'll give you so much information, but you key yourself on, laser focus on the buzzwords. Buzzwords are clues that will lead you to the diagnosis and let you rule out other problems. This is classic NCLEX question, but they're not going to write it like that. Give you like 15 paragraphs and you have to figure it yourself. But when you know what you're looking for, they will put the first keywords in the first 2 lines, the first 2 lines of the sentence, of the question, the first 2 lines of the case, they will be occluded. How about the same patient? Okay, he came in with a sudden, right? Tearing, ripping, chest pain, radiating to the back. You don't need any more information. You shouldn't be looking for, trying to figure out what his leg look like. Or you read it carefully, go through easily, but this are your buzzwords. This is what you hear it to say, I know this. No matter how they try to distract me with other psych problem, any anxiety, sudden tearing, ripping, chest pain, radiating to the back, you should be able to figure out what it is. The same patient, sudden onset of abdominal pain, radiating to the back with a bruise head. In the when you feel it or you auscultate, you felt a bruise. What do you think it is? You don't need any more information to make this diagnosis. You don't need any more. Once again, 55-year-old male with calf pain when walking, but pain goes away at rest or when he stops. Do you need any information to know that this patient has claudication? This is no DVT. These are buzzwords, but they're not going to tell you. They'll give you 15 paragraphs or no sentences, and you have to figure it out. So as you study, pay attention to each diagnosis, every diagnosis that you know of. Like, once again, 55-year-old with the left lower quadrant pain, fever, white count of 20,000, nausea, and vomit, you don't need any more information to know that this patient has what? Diverticulitis, acute diverticulitis. So as you study, pay attention to buzzwords. And like she said, buzzwords as you study. And you know, every diagnosis, go through the mental process. That these are the key things. This is what I'm looking for. No matter the distractors, I'm focusing on this. Once again, thank you for watching. Take care of yourself. Keep charging. And all the best of luck. Success is yours. Bye.